Well, we are 2 weeks into the new year, and today a leading U.S. health organization is releasing its annual report on what to expect in 2026 when it comes to cancer cases and death rates. Mandy Gaither has a look at the data and explains why experts say there is still work to be done to improve cancer care and outcomes.
First, the good news. In a new annual report, the American Cancer Society says cancer deaths continue to decline in the U.S., largely due to less smoking, earlier detection of cancers, and improved treatments.
We've made more progress in the treatment of metastatic cancer in the last 20 years than we did in the history of mankind before then. So we are making real progress.
But there's bad news too. In 2026, the organization projects more than 2.1 million new cancer cases in the U.S., along with more than 626,000 cancer deaths. Lung cancer remains the leading cause of those deaths, killing more people than colorectal and pancreatic cancers combined. Those are the next two deadliest cancers.
We've seen a 5-time improvement in overall survival for metastatic lung cancer patients, but only at 10%. So while there's been great improvement there, there's still a long way to go.
Disparities also remain. Alaska Natives and Native Americans have the highest cancer death rates. The organization says that's largely driven by lack of access to care, as well as environment and lifestyle. Black women are also less likely to survive breast cancer and are more likely to be diagnosed at a later stage and have poorer outcomes for endometrial and uterine cancers. The U.S. continues to see rates climb for men with advanced prostate cancer, and Black men are more likely to be diagnosed and die from that disease.
There's still a lot of work to be done.
For Health Minute, I'm Mandy Gaither.
Dr. William Dayhut with the American Cancer Society said it's also important for the U.S. medical community to prioritize care for cancer survivors because the disease affects a patient's day-to-day life, social connections, and finances, and their needs in light of those aren't always met.